Better Lives, for instance, we worked with families in a particular local authority to look at how can they drive change and self-direct. They're people who support, they have family members, either who are older people, parents, and also people with disabled children and family members. So how could we support those families to have a voice and drive what was going on in their local area? So that was actually about boosting people's voices so that they could work and they understood the systems and the structures. Families were often in a position where they're supporting a loved one who has a support need, and they don't understand the system. What skills do they need? What knowledge? We talk about that knowledge is a power. What knowledge do they need to be able to co-produce and work with the local authority? They actually need a lot of the knowledge about how things work, and therefore can use their voice more powerfully in having things change and having things work in a way that both they and their loved one are heard. So the Better Lives project was about doing that and giving families and individuals the skills to be able to keep that role ongoing. And so there's a particular area in the east of England where those families have continual engagement now without our support, so that's co-production that keeps being continued. And what's happening, because those people have been supported to know how to influence and how to have a voice, the local authorities started asking them. So they've started going along now and saying, oh, we now know who we can ask to get involved if we want to make a change, if we want to introduce a new policy, if we want to do something to set up a new service locally. We now know and value those voices. Doing an evaluation at the moment on a very, very huge falls prevention strategy. Huge being that it covers a number of different health bodies, a number of different social care bodies. They have different governance, they have different finance systems. All these people trying to work together across a local area where the setup is quite complex. There's lots of different bits of power held in different places, but jointly they want to prevent falls, because that's been seen as one of the biggest issues for older people in the area, which is causing people to firstly go into hospital and move into residential care. And so it's sort of the idea of prevention if we can get in. So we're evaluating that. What we're doing in terms of co-production is we're training up local evaluators. So local older people from the area and staff members that are working on the ground in these different places, so that we have a team of people that are on the ground and are able to see what's going on, help evaluate the data, help give context to things, and they'll share in both the writing of the evaluation, the feeding back, and also making the changes as they go along. So rather than us just going in as an external body and saying, well, we think this is working and these bits aren't, and these are our recommendations, those are actually held and owned by a number of people who then end up skilled up in how to self-evaluate. So we worked with Joseph Rowntree Housing Trust, are a home care and residential care organisation for older people in the UK. And what they wanted to do was work out a quality model. How do we know if the support we're providing is of high quality? What is it the people we're supporting jointly want to see us achieving with them? And so we worked with a number of different groups across the whole of JRHT, which were mixed groups of people that were using the services, staff that were working with them on the ground, managers and leaders, to hear and to shape what the quality measures were going to be and what people said in general they wanted to have happen in their lives and how they could measure it. And they designed, which they also use as a planning process, but they can also use it as a way of evaluating the quality within a service. And some really, really key things. When we talk about co-production and giving people the voice and a chance to ask for what it is they want to achieve, there's sometimes a worry that they'll be asking for the world. There's sometimes a worry that they'll just say, well, actually, I don't know, I'm happy with what I've got at the moment. But there were some really simple things, and I think because this was done at a group level, people were able to challenge each other. So one person says, well, these are the kind of things that matter to me. They were able to sort of inspire each other. Oh, actually, that quite matters to me as well. So you've got people that are finding it difficult to think about what they want to achieve or what a good outcome would look like for them. Being in a group where they can inspire and discuss with each other is really powerful. So these were the key areas that I think there's sort of 6 areas of things. Feeling good about myself and being valued. There's some more detail that are in the middle that's harder to see. Having the support I need and want staff and others really knowing me, so there was stuff around consistency of who supported people and how they made that happen. Being happy in their homes, there was quite a bit of stuff around housing and what it means to have your own home, but what it means to be happy there and what adaptations and things need to happen to enable that, and so on. So it's both the co-produced quality sort of approach, but also a way that the organisation can go back and check with people that they're getting right. Hampshire were a bit more, I'd say, ambitious in what they wanted to co-produce. So Hampshire is quite a big local authority that covers a big chunk of the south of England and a number of cities, and also quite a rural community. And Hampshire commissioners, so the people in the local authority that commission and pay for the social care that's going on there, be that through individual ways, but also through commissioning home care, through commissioning residential care, etc., decided that they wanted their whole strategy, commissioning strategy, to be co-produced. So they asked us to come in and help them work with groups of people across Hampshire to say what was, and quite simply, what's going well for you at the moment, what's not going well, what would good look like in terms of things that would happen to you. Initially to create a vision, a shared vision across all these individuals in Hampshire, and then to look at what would some of the key things be that came out of that vision that Hampshire now plan around. And so it turned into a commissioning plan. Now, I don't know in terms of co-producing whether all the delivery is continuing to be co-produced, because we were there kind of more at the start of the journey. But what Hampshire do know is that the older people that live in that area have had a say in what the priorities are of where they're putting their public money. One of the things I did reasonably earlier on, which I co-produced, and I co-produced because it was that situation where I thought, oh my goodness, I think there's diverse views, and if I don't get both people in the room, or both parties in the room, or all three parties in the room, we're going to end up with a system that everybody's unhappy with for some particular reason. And that was looking at a recruitment strategy. If we're thinking in an organisation that was providing home care, residential care, daycare, etc. One of our aims, we were starting to think about, actually, if we're listening to people, shouldn't they be choosing the staff that they have? Shouldn't they be having a say in who we employ as staff, even if we're still employing them? And so I worked with a group in there. I was in the organisation, so it was a different role. I wasn't going in externally. But I worked with a group of people, and you're thinking then, who do you need in the room? Human resources. They're going to have a real say in us getting this right legally. People that we're supporting, they're going to be saying, but I want to be able to choose this, or I want to be able to choose someone who just supports me. What are their messages going to be? Staff that have been through the recruitment system as it is, so we could really learn about what's working, what's not working now. Managers that are often responsible for the recruitment, they're responsible for having enough staff to run their service. So all these different players who would have completely different perspectives to build a system which would enable individuals' voices to be part of that recruitment decision. And I was absolutely petrified that they all had different things that they were going to want. I thought, I'm sure they all haven't got the same agenda. I'm sure human resources are going to say, no, we want this and this is what's going to have to stay. But actually putting them together, getting people together, I was really astonished in the amount of agreement about, actually, this is the things that's going well at the moment, these are the things that aren't going well. They agreed that mass recruit, and I thought HR would love the fact that we could wait until we had 20 jobs that needed to be recruited to, and then, bring in a mass of 20 people at once, whereas individuals meant they sometimes suddenly had loads of new staff that were appearing that they didn't know. And I thought that, but actually, human resources said, no, we would love it that we recruited directly when individuals need it, when particular teams needed people. So the co-production went as far as developing a strategy and a process that the organisation would use, but ongoing co-production in how people choose their own staff and how people are involved in that decision making, which everyone's happy with. So that's a sort of an example of a set project, but that has ongoing policy sort of implications, because the thing itself is then co-produced later. Attitudes and beliefs, I think, are really, really key, that often need to be put aside. And one of those attitudes is the panic and the need to deal with uncertainty. So if you decide to co-produce something, So a project I was involved in very recently was we were co-producing learning materials to help staff that work around an individual at the end of their lives. And that's lots of staff. There's lots of health staff, social care staff thinking. And it was decided that, and there was funding for actually what do we need to train, what skills do people need to have, what is it that they need to know to make individuals who are nearing the end of their lives in the UK have good support all around them, where lots of people need to work together. So we decided to co-produce that. And I had one guy who was a colleague of mine who really struggled with the uncertainty. He kept saying, but what's it going to look like? What do I tell people the result's going to be at the end? And we had to keep saying, trust in the process. We don't know what it's going to look like because actually the group's going to be designing it. People are going to be telling us their stories about what's happening in their lives and what they want to have happening with professionals. So you need to be able to hold people's uncertainty almost and say that things will, we have to accept that if we are truly co-producing something, we don't necessarily know what the result's going to look like. We really don't. External facilitation, I do think, can happen, particularly I mentioned earlier on where there is different power issues going on, so that you've got one person asking the questions of everybody. Getting communication right for people. There's a real tendency for, in sort of professional circles for us to use jargon, for us to use acronyms that mean things, and actually if someone comes, if you're wanting staff and individuals, older people, carers, etc., to get involved in those discussions, something about remembering our language, remembering how we adapt communication, and also adapting communication for people with wider support needs. Sensory impairments and complex sort of communication issues associated with dementia or learning disabilities, etc. So looking at how do we get that communication right. Some of these I've mentioned along the way during the day, but look out for assets. People often don't know what they bring. So one of the things that we noticed when we were looking at designing these learning materials is professionals suddenly realised that they brought personal experiences and that they could use those. And we had moments where GPs would say, I know this happened in my own life, but when I was working with my patients, I didn't apply it. I didn't apply that personal experience of what it was like for me when my mum was older or when my mum passed away. And there's this sudden realisation that people bring things that they don't realise they have to the table. And you kind of have to look out for them and say, oh, did you just say you've got this connection, or did you... people, they won't necessarily right on the first day say, this is what I bring. These are the kind of skills and things I have. So just a few key reflections on things that can help along the way. And one of them is, and that's on the name of the document, personalisation, don't just do it, co-produce it and live it, it's just do it. There's a real message of just give it a go, pick a single issue that you think you want to tackle and try it. Think about who you need in the room, think about how you're going to help them frame it, try and plan some time together, etc., and just give it a go and see what the results are.
I came along today as an invited guest from COTA. We were successful in the Action Research Grant earlier in the year, and we're working with COTA on that. Co-production to me is listening and involving the older person and clients in our decision-making process. I think co-production is particularly important these days because if we actually don't listen to our customers and our clients, we're not going to have any. Co-production is different to what we have done, like many other aged care providers have done in the past, in the fact that the bucket of money was given to us to utilise it to meet the needs of the clients. We often provided, rightly or wrongly, a menu of services, whereas co-production and our transition to it will be listening to them, providing the services that they need when they want it, by whom they want the services to be provided by.
I think co-production is very important, I think both because of CDC in itself, but also because consumers generally are wanting to have more and more say about what they want and how they want to have it. And I think CDC is really, in some ways, a reflection of what consumers want. And I know that as I get older, that's certainly what I want, is to have a say in the services that I have and how they're delivered to me.
Co-production is important insofar as asking the consumer, the customer, however you want to frame it, are we actually giving you what you want? So, and then actually listening to the answer and then working with that person around giving them what they want and then measuring it. Is this what you want? Then we know we've been successful in co-production.